Hey, Assalamu alaikum. In this video, we will understand about the ulcerative colitis. So, ulcerative colitis is the inflammatory disease due to the large intestine's mucus layer dysfunction not properly. So, in this, let's understand about that. So, here is the digestive system of the person, contain liver, the stomach, etc. So, whenever the smoking also the major cause of the ulcerative colitis, this is the liver, esophagus, stomach, and the large intestine, and rectum, and anus, cecum, and small intestine are also present. So, large intestine contain ascending, transverse, descending, and sigmoid colon, and a rectum and anus, while the small intestine, ileum, jejunum, and duodenum. So, the large intestine and rectum is involved for the ulcerative colitis first. So, it is only not like a Crohn disease. Ulcerative colitis, let's understand about that, affect only the large intestine, colon, and rectum. Inflammation usually start at the rectum and spread upward toward the large intestine through the colon. Unlike Crohn's disease and ulcerative colitis affect the innermost lining of the colon. So Crohn's disease basically not affect the innermost lining of the colon. We will discuss in the next video about the Crohn's disease. But this is the same like a ulcerative colitis, but the differentiation we'll discuss in the next video. So in ulcerative colitis, living with ulcerative colitis is very challenging and the genetically can be dominant. So this ulcerative colitis. So large intestine and rectum is involving to affect an inflammation. So first rectum, then large intestine. So let's understand about the causes, genetics, immune system dysregulation, and the T regulatory cell dysfunction and not produce the cytokines for the inhibition. But on the other hand, important thing you should need to understand the environmental factor and smoking as well as infection. The medical history diagnosis is the medical history, physical examination and blood test, stool test and colonoscopy. On the other hand, the treatment can be no care but medication and like other lifestyle changes and the diet changes which can be effective and decrease the ulcerative colitis progression. Symptom can be diarrhea, abdominal pain and rectal bleeding as well as weight loss. Let's understand about the pathophysiological aspect. So this is the epithelial cell of the large intestine of the rectum, which does contain a mucus layer. But the mucus layer, when disrupted, will lead to invasion of the pathogen. But it is not possible whenever. So due to the tight junction between the epithelial cell. So this tight junction will not allow. Here is the lamina propria, where reside of the immune cell, like innate immune cell, but the adaptive immune cell, which that adapt after the innate immune cell response. This is the production of mucus from the which that protect the harmful bacteria. So this is the microbiome in the lumen. So in the lumen, the microbiome here is the mucinous layer. This produce the mucin protein which that protect against the pathogen and not allow to invade the bacteria into the lamina propria and blood circulatory system. The production of mucus from epithelial cell is a barrier immunity important for the prevention of pathogenic invasion. Commensal microbiota can invade. The commensal mean not harmful but not beneficial, which that reside in the large intestine for consumption, the other waste and not beneficial for us. So whenever the loss of the mucinous layer will lead to invade the pathogen. So in this way, basically the increase the permeability and uptake antigen as well as impair the mucinous layer and the mucin which that will lead to allow to toll-like receptor are present in the dendritic cell activate, and the dendritic cell will activate to engulf this antigen to represent to the T helper 0 cell, the CD4. So the antigen basically representing cell like macrophage also activate whenever it will uptake will lead to increase the necrotic factor kappa B. So in this way the process microbes through the macrophage also and dendritic cell will lead to increase the cytokines and interleukin 12, 23 and 6 as well as 1 beta and tumor necrosis factor alpha, as well as the chemokines also produced from this immune cell, innate immune cell, like CXCL1, 3, and 10, which that target to the endothelial pass from the endothelial cell into the blood circulatory system for recruitment of leukocyte. So this is the command of the recruitment of leukocyte from the lamina propria. So this message come from the lamina propria into the blood circulatory system. In this way, the circulating T cell will bind with the alpha 4 beta 7 receptor with the MADCAM1 molecule. Whenever it will be bound, the T helper 0 CD4, like the T helper CD4 naive T cell, which that is inactivate, to activate through a HLA2 receptor through a T helper 0 cell to activate to produce interleukin 4. If the interleukin 4 produced, so the effector T helper 2 cell, which that activate, and the natural killer T cell, which that also like the CD8, which that lead to activate and produce interleukin 4, 13 and 5, which that increase the defective regulation of tight junction. In this, the tight junction will be defective. When the deficiency of the T regulatory cell activation will lead to this defective regulation of tight junction will allow to permeability of the microbiome into the lamina propria. The cycle will continue, will lead to progress the inflammation. So I hope you make sense about that.